I'm Dr. Duke Majan. Welcome to the Duke Spine Institute's live broadcast of live spine surgery. It's January 24th, 2023, and our patient is undergoing the Duke laser disc repair, left shot L3-4, L4-5, L5-S1. First, we're going to be heading towards the L5-S1 disc, and this patient's herniations are off to the left side of the spine. Shot, AP. We're going to be going into the L5-S1 disc first. We always start with the L5-S1 if that's one of the discs we're treating. It's the hardest one to get into, so we use that one as our natural determinant of the entry point. Okay? So for those surgeons out there that do endoscopic spine surgery, L5-S1 is the hardest to get into, and the starting point is the most difficult. So we're going to use this starting point right here to guide the starting point for the other discs. You can feel the herniation. Show them the herniation. You can actually see it on the x-ray. Henry, can you see that? Looks like a balloon.
Yes, we can.
And the needle is touching the balloon. So huge. I could feel it right there. It's like bouncing. You okay? Yeah? All right. Well, shot. Wow. Incredible shot. Is he all right? Yeah. So we've just lay still. You're doing fine. We've given him. He's getting sedation from our anesthesiologist. I've given him some numbing medicine under the skin. I'm going to give him a little bit more under the skin. You're doing great. I'm going to give you a little more numbing medicine. Yeah, it's okay. So we're infiltrating. That's all right. He has a low pain threshold. Very common. Watch out for that. And the medicine we're using is a combination of lidocaine and bupivacaine. The lidocaine works right away. The bupivacaine or marcaine takes a while to work. It takes a few minutes, right?
7 minutes.
7 minutes to start working. So that's why we do a combination. We also have some epinephrine to stop the bleeding, and basically 3 drugs, and maybe some bicarbonate, possibly. Yes? No? Maybe so? Not today?
Not today.
All right. Our patient is a patient who's traveled here because he's had back pain for how long? 12 years. Let me have an AP. I'm going to talk to you while I'm doing the surgery. So I'm going to keep working as I'm talking. But that way I can tell you what I'm doing. He's a thin patient, and honestly his spine is very far back towards this back of his skin. So he's not a deep spine like many of our patients. He's unfortunately, I hate to use the word, but it is the proper word. He's a superficial spine. Okay, but not the kind of superficial we think in high school when we talk about some people we don't like. This is a superficial, meaning close to the skin. Shot? So it's actually a good thing for me and him. Shot? All right, heading towards disc number 2. And I'm navigating around the facet, a little higher than I want to be. Shot. Remember, you want to come in low in the foramen, well below the nerve root. Show them where the nerve root would be on that picture there. You guys see the pedicle? That's the pedicle, the bone. Show them the pedicle. The pedicle connects the vertebral body, not you. You keep your eyes closed. Vertebral body to the facet. Show them the facet or the lamina. Yeah. Okay. So just under the pedicle is where the nerve comes out, and we want to be below that, and we are. Are you comfy? Everything's going well, so lay still. Okay? Can feel the herniation. Yeah. So we're inside the disc with 2. We're almost done, okay? We're going to put you to sleep in just a few minutes. So look, turmeric, no bleeding. Maybe 2 drops of blood. So the turmeric is not a problem. Doesn't mean I want people on it. I'm just saying the fact that patients on turmeric is not an issue. Shot? Alrighty, looking good. I want to be a little more anterior shot. Perfect. How you feeling, friend?
You all right?
All right. AP. By the way, I'm up against the herniation. Maybe you can see it on that lateral x-ray at L3-S1. You could see the tip of the needle touching the herniation in the foramen. People will tell you can't see a herniation on x-ray. It's true. You really cannot. However, you can if you have the best fluoro or x-ray machine in the world, which we have. But I would never really rely on it to tell me definitively. Are you comfortable? Can you feel me?
How you doing?
You having any pain?
You okay? He said yes, it's okay.
All right. Now, can you hear me? It's Dr. Dugmajian. Are you having, how long have you had back pain for? How many years have you had back pain?
How many years you had back pain? How many? 2 years?
Whoa.
Huh?
No, it's more than 2. I think you said 8 or 9.
You just said
Yeah. 8.
10 to 12? 10 to 12.
All right. We're just going to put 12 years. 12 plus years. He's had back pain for 12 years, folks. And he's going to get rid of it today. See, watch this. See that? That's what we're doing today. Eliminating the back pain. Where do you live?
Where do you live, my friend? What did you say, Orlando? Oviedo.
Oviedo. All right, folks. When I asked him the other day, where is your back pain? He told me it's here. Show me. He pointed here, he pointed here, and he pointed here. Okay? Those 3 spots in this area. When I saw his MRI, I knew exactly where the pain was coming from. He has 3 herniated discs, L3-4, L4-5, and L5-S1. So L3-4, L4-5. How many of my surgeries have you watched? Too many to count?
How many have you watched on video? How many? 6.
6. All right. This is the herniation. My wife says it looks like fingers. I'm drawing fingernails. I'm not. The nerves come down your spine, and then they go past the back of the disc and down your leg. Okay? Are you comfortable? No pain? No, no pain. How bad is that on a scale of 1 to 10?
8.
The highest it went was 8? What was the highest it went?
8, 9, 8.
8. He's talking. We don't need a dissertation. Just the highest the pain went on a scale of 1 to 10. 10 being the worst pain of your life. What's the highest? Jordan, show us on the x-ray. 8. Is that where you typically...
I said 9.
9. All right, so 9. We always go with the highest number. Jordan's going to show you. Show us the tear. See the white arrow, folks? Henry?
Yes, we do.
Show us where the tear starts in the middle, in the inside of the annulus. Nope. Right there. And then show us where it goes. Yep. And show us the herniation, the outline of the herniation. There it is, like a balloon. All right? Now, is that where you typically get back pain? In that area? Yeah. He said yes. Okay, are you comfortable now? Is it better? Okay, he said it's better. You comfortable? He knows what's coming next. How bad? He just said, How bad did that go? The highest? 10. Is that where you typically get your back pain? Okay, we found your back pain. Show them the tear at L4-5 that we just tested. You guys see the dye leaking out through the tear? There it is. Okay? That's where the pain comes from. Why did I have to discover that? I don't know. Why couldn't somebody else discover it and teach all of us? That's the way it should be, but I guess God chose me for that. How bad is that on a scale of 1 to 10? 10? Is that where you get back pain? All right. Well, guess what, my friend? We found 3 painful discs, the ones that I thought were painful. When you wake up, you'll be done with surgery, and your pain will be gone forever. Okay? Congratulations. I want you to count in Hindu for me. Can you do that? Hindi? Not Hindu, but Hindi. Is he counting in Hindi? He's gonna laugh at me when he sees me tomorrow. I'm sure his wife is laughing at me right now. Okay? Sorry, but we have to make people count in their their language, their natural first language, native tongue. It's just something we do here at Duke Spine. I can tell you though, he is an American. Look at that. Red, white, and blue. Very patriotic. Okay? So we're going to start with the bottom disc, the L3-S1 disc. And you can see, Jordan, show us the x-ray. Henry, pull up the x-ray again. Look at that L3-4 herniation. Huge. Huge. And show the tear at L3-4. Yep, right there. So you can see the dye was injected in the middle of the disc and it leaked out through the tear. So he's got 3 tears, L3-4, L4-5, L5-S1, and they're causing 10 out of 10, 10 out of 10, and 9 out of 10 pain. I think the first one was a 10 out of 10 too, but he just was trying to be stoic. All right, let's get going. Any questions from our audience?
Yes, we have a question from...
Sean?
We got a question from Lupisa on Facebook.
Sean, yes?
And they asked, I would like your opinion on injecting ozone into the disc as a minimally invasive procedure.
Yeah. Ozone injection into the disc. Prolotherapy, been aware of it for years. It doesn't work. It doesn't work. We've tried it. It doesn't work. You can do it, but it's not going to fix anything. So that's my opinion. By the way, my opinions are based on things that actually work or don't work. You know, I don't have any independent opinion. In other words, I don't have an opinion because I want to have an opinion. I have an opinion because I've seen these treatments either work or don't work. And we've tried a lot of them, if not all of them. And most of them don't work. But this treatment does work. All right, let's show the video on why is it that herniated disc can actually cause pain. Okay, how does that work?
Traumatic injury to the disc can cause annular tears to form. Pressure on the disc causes herniation of the nucleus pulpus through the annular tear. Inflammatory tissues develop within the annular tear, causing back pain. The inflamed annular tear generates pain signals. Additional injuries can cause symptoms to worsen. Inflammation from the annular tear can spread to nearby nerve roots, causing leg pain. Signals travel up nerves to the brain, causing localized back pain. Pain signals reach the primary somatosensory cortex, causing conscious awareness of pain. If you have a herniated or bulging disc and back pain, submit your MRI for a free review at www.mri.dukespine.com.
Yeah, gotta have a sense of humor. Welcome back. All right, so for those of you who just watched our animation, that is the animation showing why is it that a herniated disc actually causes back pain. I just want you to notice something, Henry. You see this here? Let's turn the light on for a second in the room. Can you see the tube?
Yes, we do.
I want you to, folks, if you watch these surgeries, notice this is the most the tube has ever stuck out, right? And that's because he's thin, but also more importantly, I've been saying this for years, his spine is very much this way, towards the surface. Therefore, we don't have to go so deep. Our angle is more that way rather than that way. But remember just a few weeks ago, we had a patient who we sunk the entire tube. The same tube was sunk all the way to the hilt, twice as deep. So there's tremendous variation in how deep the spine is and how deep the discs are. The beauty of this procedure, we're not damaging his spine at all. We're not removing the lamina. We're not doing a laminectomy. We're not doing a discectomy. We're not doing a partial facetectomy, removing the facet joint. As a matter of fact, all we're doing that hurts his body is the cut on the skin. And that's a 7 millimeter 1/4 inch incision. That's it. Everything else is done without damaging any of the tissues. That's how minimally invasive this procedure is. Thank you, Oscar. All right, we're ready to get started. This is the laser, by the way, in case you've never seen it. And the laser is fascinating. Laser energy is what we're using, not ozone, like was mentioned earlier. We use laser energy. Lasers work. Ozone, doesn't really work. It's just a kind of a, in my opinion, a scam. I wouldn't do it. Doesn't work. Do it if you want to, but you'll still be in pain. All right, so what we have here, folks, is the herniation and the tear, and we're cleaning out. Look at that. We're cleaning out that's herniation right there. The laser is delivering the energy, the laser energy, directly to the herniation, and the herniation is sucking it up and then exploding into little pieces. Basically, it happens so fast you can't even see it. You would have to slow this down. Probably 1,000 times to see the fragmentation that's happening as a result of delivering this laser energy straight to the herniation. Okay? I know you guys are just kind of watching this laser jiggle around and things are happening, but you're not sure what's happening. What's happening, folks, is that piece of material right there at the end of the laser is literally sucking up that energy in a microsecond and then blowing apart. That's how powerful the laser really is. And that's the effect we want. We want vaporization, coagulation, or cauterization. And that's how we vaporize or get rid of these herniations so quickly and so precisely. Now, some people ask me, doesn't the laser get hot? Yes, of course it gets hot. But what keeps it cool? Well, we have it bathing in cool liquid, like a, what do you call it? Not antifreeze, but I guess it is antifreeze. Of course, don't put ethylene glycol in someone's spine. We're not using ethylene glycol or antifreeze, but basically we're using a cooling system, much like your computer will cool its graphics processing unit or GPU. You know, you have those cooling systems for the GPU. We have a cooling system for the laser here. I did not invent it. This was invented by people a lot smarter than me, and we're just using their technology here for the Duke laser disc repair. So we've taken pieces of technology. Of course, everything we do is FDA approved. We don't have any non-FDA approved stuff here, except for Dr. Berndes. He's not been FDA approved. He's our anesthesiologist. But in all seriousness, everything we do here is FDA approved. People ask us that. All right. This is the most precise surgery in the world for the spine. There is nothing more precise. The reason why it's so precise is that I'll give you an idea of how small things are. You see the laser fiber, the glass? That's 1 millimeter wide, 1 millimeter. And the effect of the laser is half a millimeter out of the tip, okay? So the laser beam doesn't shoot out like you see in Star Wars. It actually just exits the tip, and only things that are touching the tip within half a millimeter of it are actually going to be vaporized. Everything else is safe. Go ahead.
We have a few questions. This first one comes from Tyler on YouTube.
Yep.
And they asked, will you ever see someone on an urgent/emergent case from Oregon? I have 11 different disc bulges, some with nerve compression and gastroparesis, restrictive lung disease, IBD, and more.
Yeah. All right. So I missed the first part of the question. I think it was saying, will you ever see someone on an emergency basis?
On an urgent/emergent case from Oregon.
From Oregon?
Correct.
Yeah, we do see patients on emergent, urgent. Absolutely. And if you're losing function in your legs, neurological, or other neurological function, then it becomes an emergency situation. Yes, we will, as a matter of fact. And if you want to get in and get help right away, then I would strongly recommend you have us do what's called an MRI review, where I would review your MRI. The next day for MRI reviews, I believe, is tomorrow. So if you call Sam, and you better make, well, it may be too late for today. If you FedEx your images, your CD of your MRI over to us at Duke Spine Institute, FedEx it, put attention SAM, S-A-M, MRI review, then we can have it tomorrow, and I can look at it, and we can do a virtual consultation. Go ahead and put the link for dukespine.com//VC, virtual consultation, and use this link today. Get your information uploaded into our system so that at least we have your name, your history about your problem, and that way, do that tonight, and FedEx from Oregon, do it right now. Go out and FedEx your MRI here, okay? And put attention SAM, S-A-M, MRI reviews, okay? And that's your best chance of getting seen tomorrow so that we can plan an immediate treatment.
They replied back. They said, I already put in a request for MRI review. It allows me to send the images to an email, but won't let me download them.
Yeah, if you have a portal, then you just need to give us portal access. And that's done through the MRI review process. So just call Sam tomorrow and give her a number for Sam. It's 321-775-1299. If you call that number tomorrow morning, and she'll be here around usually no later than 8:30 Eastern Standard Time. If you call that number in the morning, you can ask Sam to pull up your MRI and see if she could work you in tomorrow in the afternoon here, which would be your morning, and we could do an MRI review and figure out what's wrong, what needs to be done to fix you. And of course, we can get you in next week and get it done. We believe in expedited service. If you're super motivated, just fly out here. We had a patient do that a couple of weeks ago, by the way, from Texas. He just showed up. We ended up operating on his cervical, lumbar, and thoracic, all in the same week. And he told my staff, I'm not going home till Dr. Duke fixes me. He's a helicopter pilot. Love that guy.
How's he doing now?
Oh, he's doing great. He's doing great. No more pain in the thoracic, no more pain in the cervical, no more pain in the lumbar. He's so happy. He spent how many years? He had to retire from his job because he was in so much pain. And nobody could fix him in Texas. So he literally just drove out here or flew out here and said, I'm not leaving until Dr. Duke fixes me. At first I thought he was joking, you know, so I was laughing about it, but he was serious. Yeah, stayed in a hotel for, I don't know, a week and then left. Oh, that cracking wasn't a good sound. That wasn't my spine. That was the pedal for the laser. All right, grab her. Oops. Luis?
What happened?
I don't know. I heard a crack with the laser pedal. It's still working.
Can check, somebody check the pedal, please.
This blue stuff is herniation. It should be okay. Is it okay? Yeah. It's sturdy. It's made in Israel, so it better be good. Right, Henry?
Correct. Yes, sir.
I might have to send you back to Israel with the pedal. Fix this.
I'm not opposed to that.
Henry, watch Fauda?
Just,
Did you watch Fauda?
did you watch Fauda?
Not yet. Not yet.
Not yet.
I'm so sorry, Berndes. I promise I will watch it. It's just all a matter of time and when.
Hey, some of us actually work for a living. We don't have time to watch so many movies. You knew that was coming,
Yeah.
right, Berndes? He's a young man. You know, young men do things on the weekend other than watch TV.
I like to make time for stuff like that. That's where I like to get my education in film going, whether it's a film, foreign film, TV, you name it. But given that, we do have a
The glory he's saying now.
the glory. Is that what Denzel Washington, or am I thinking of something else? I know he was in a movie called Glory. Is that what we're talking
Who,
about?
Denzel Washington?
Yeah, with Morgan Freeman.
Different.
Oh, different. Okay, never mind. Sorry.
Well, I know this patient's wife is watching. I hope she's doing well and not freaking out. We want you to know your husband is doing really well. And I think he's going to do great, okay? I really do. Let's get the grabber. Almost done here at L3-S1. Then we're going to move on to the next disc.
We have a couple comments and questions.
Uh-huh.
These comments come from Tyler from when talking about the MRI. They said, I will send them this afternoon. Thank you. Thank you very, very much.
Welcome.
Feels like my life depends on it. I'm retired from the Army. Back pain started with a parachute jump injury. It's been neglected by the VA for 15 years, and I'm just fed up.
Yeah. I'm so sorry. You know, it's unfortunately the truth. The VA does not want to take care of our vets. The VA system is broken, and they're lying to the vets, telling them they're going to take care of it and give them great health care. Well, they're not. Okay? They're not. They're not. I worked in the VA system. I know how it works. I was there for many years in Gainesville, Florida, working at the VA. And my friends and I, neurosurgery residents, I tell this story a few times, but I'll tell it again. We were looking at the veterans coming into clinic and to the neurosurgery clinic, and we realized we were seeing like 5 of them in the morning and 5 of them in the afternoon. And that's between 3 residents, 3 doctors. And we were like, wait a second, we could do a lot more. We could see a lot more patients. So we talked to our supervisor over there at the VA in Gainesville and said, let's change the schedule. Hasn't been changed in years, like literally 20 years. Let's change it because we're motivated to help these people and get more of them in and treated. So we put in a request to change the schedule. We had to. Couldn't just do it ourselves. They wouldn't let us. And we wanted to change it to 15 patients every morning and 15 patients in the afternoon. The VA came back and said, no, we're not going to let you do that. I said, why? Said, it's against our protocol. Basically, they don't want to pay for the care. They don't want to pay the surgeries that happen as a result of those clinics, the expense to the VA. They don't want to increase their expense. They're trying to reduce benefits rather than provide proper benefits to veterans. So, what's that? What happened to them? Oh. Huh. God. Yeah, it is illegal. Yeah, that was a whole nother thing too, because we went after that. We wanted to do more surgery because, you know, the way we help people in neurosurgery is by doing neurosurgery. And we went to the head of anesthesia at the VA in Gainesville, and we asked him, we would put on more surgeries than normal. Like we would, instead of doing 2 a day, we would want to do 3 or 4 a day. And to do that, you're going to go past 3 o'clock. And so the head of anesthesia would come and talk to us and say, why are you guys putting these surgeries on? And we said, because we want to fix these people. We want to get them better. And they would say, no. If you go past 3 o'clock, we're not going to let you do the surgery. 3 o'clock is like 3 o'clock. We're just finishing half the day normally in the hospital. What is magical about 3 o'clock? There's nothing magical. They just don't want to do surgery. They don't want to take care of the vets. So they try to save money by bottlenecking and having fewer hours, fewer clinics, fewer staff. It's all about restrict, restrict, restrict. Then it looks like maybe it's a doctor problem rather than an administrative problem, when it's really an administrative problem. Okay? The failure of the VA system is an administrative problem. Oh, let me have some num-num, or the other one. All right, 1 down, 2 more to go. Hold on. Let's get the scope in. I can help you if you put pressure. Henry.
Yes, sir.
And we've done the how does a herniated disc cause back pain, right?
Yes, we have. We have not shown the others.
Let's show the shot. Let's show the DLDR and how it works. Shot.
Disc herniations are a common cause of chronic back pain. The inflamed annular tear causes back pain. Inflammation of the nerve roots causes leg pain. A Band-Aid-sized skin incision is made. A small tube is inserted without damaging the bone or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own. If you have a herniated or bulging disc and back pain, Submit your MRI for a free review at www.mri.dukespine.com.
What?
Like what I asked for, I guess, because in the papers they sent that I got faxed over, it doesn't have.
I have no idea what you're saying. I need you to get in touch with the lab right now,
I will.
and you need to get a result for the cultures, aerobic, anaerobic fungal. Okay? Because it's been a week now. Right? Let go. And if you don't get an answer from the tech, you ask for the director. Okay? Shot? All right. That looks pretty good.
We have a question.
Yes.
This, I believe they're seeking advice, actually. This comes from Imran on YouTube.
Enron or Enron?
Imran, I-M-R-A-N.
Oh, Imran, okay.
Imran. And they said, I am a patient of the cervical spine for 25 years, and now it's getting too much trouble to move. Muscles are so weak and stretch and tighten in the neck muscles. Some doctors say that I need surgery, but I am so afraid. And some doctors are saying that disc replacements are safe, and what costs is in America for the surgery, and it's safe. And it can be the disc repair. Yes, it could be the disc repair. I believe they're asking around for suggestions or advice.
Yeah, Imran, hi, welcome to our stream. Listen, all the spine surgeries done in the world I've done at Duke Spine, okay, in my career, 26 years as a neurosurgeon. I've done artificial discs. I've done everything that can be done, okay? Nothing out there is even close to this surgery in terms of it being effective at eliminating back pain or leg pain, leg symptoms such as weakness, numbness, tingling. Nothing is even close in terms of the recovery, 1 hour and going home. Nothing is even close in terms of the minimally invasiveness. 1/4-inch incision, nothing is close in terms of the healing and going back to normal activities, 1 day. Okay? The other surgeries are all weeks, months. Nothing comes close in terms of postoperative pain. We don't even give pain medication for this surgery. We give 1 night Tylenol, which is nothing, acetaminophen basically, and a muscle relaxer called Robaxin, which is cyclobenzaprine. This is over the counter in most countries. All these other surgeries require opioids, painkillers, narcotics, because the pain from the surgery is so bad for the patient. Now, that's just normal if the other surgeries go well. The problem is the other surgeries have complications. Duke laser disc repair, we don't have complication. Okay, we don't have complications. So, can you have a complication? Of course. But the complication rate for cervical fusion, ACDF, 50%. That means 1 out of every 2 patients is going to have a complication with ACDF. 50%. The complication rate for cervical Duke laser disc repair, 0. We've had 0. And I've done 600 of those surgeries. So, not only is the Duke laser disc repair a better surgery in terms of getting rid of the pain and the symptoms, but it's the fastest recovery, 1 hour, and immediate return to normal activities, except you have some restrictions with lifting, contact sports, okay? There's no comparison. If the other surgeries were better, I would be doing them. I would be doing artificial disc. Artificial disc is very easy for me to do. I've done hundreds of them. Fusion, very easy for me to do. I've done thousands of them, okay? So my point is, if those surgeries were better, I would be doing them. Because there's nothing to stop me from doing them. It's not that I don't know how to do it. Of course I know how to do it. I've done it many times. I was trained. It's not that I don't have the resources. Of course I have the resources. This is a $10 million facility. So I have the resources, I have the people, I have the training. Why don't I do it? Because it's a bad surgery, that's why. But it's the best surgery the other surgeons have. So that's all they're going to offer you is their best. But their best is not good enough. That's the point. It's not good enough. It's not even close. If you don't mind having problems from your surgery, then go have artificial disc or fusion. If you want a surgery that's not going to create problems for you, ever, you have the Duke laser disc repair. But it has to be done by the right surgeon. Okay? Has to be done by the right surgeon. Having a good surgeon is everything. There's many bad surgeons. They're going to give you complications. Okay? Many bad surgeons. There's very few. In the world of spine surgery, there's probably only, maybe the whole world, 5 surgeons I would trust. The other ones, I would never let them operate. Never. My own brother is a spine surgeon. He's a good spine surgeon. But I would never let him operate on me. My own brother. He's a neurosurgeon. He's only 2 hours away in Tampa. But he doesn't do the best surgeries. And I wouldn't let him touch me. I don't know. Did I answer the question there?
I
Henry?
believe so.
All right. So far, this patient's surgery is going very well. We're almost done. His back pain that he's had for 12 years is going to be gone. I feel confident. This is causing it right here. See this? This is the thorn. It's not a real thorn, but it's the proverbial thorn. And it's the herniation inside the back of the disc within the tear. That's what I'm cleaning with the laser. Now you can see this can't be done without a laser, and you can see it can't be done without endoscopy. So it shows you how important endoscopy and laser are. All right, any other questions?
Yes, we have two questions. First one is from OH on YouTube. And they asked, what are we watching right now?
Okay, great question. So you're watching spine surgery, and we're operating on some herniated discs in a patient's back. This patient has back pain, and he's had it for 12 years. Nobody's been able to figure out where it came from, but we did. It comes from 3 bad discs, 3 herniated discs. And we are literally inside those herniated discs. Inside. And you're seeing inside the herniated disc. That right there, that thing at the top is the laser, and that's the herniation right there. And I'm zapping it away with the laser. That's what you're watching. Okay? So you're watching surgery on someone's back to cure their back pain. Did you know back pain can be cured? Most people don't. They think they have to live with back pain the rest of their life, but they don't. Not anymore. Duke Spine Institute cures back pain all the time, every week with our procedures. But you can't get these procedures everywhere. You have to come here. So that's what you're watching. We're seeing the back of the disc. We're seeing over here some fat and blood vessels. Right there at 12 o'clock, some veins called Batson's plexus. Here is a little bit of ligament at the back of the disc called the posterior longitudinal ligament. That was a bone spur. The laser just hit. You guys see that? What's that noise?
Inflated in the back.
All right. And we're just about done. Oh, look at that herniation there. 30 seconds. All right, we're done.
Lights on, please.
We're literally looking at the just outside the disc right now in the foramen. It's beautiful. Done. One more to go. Where's the other needle? How come you don't have it on? Questions?
We have a question, or it's sharing your opinion from Lubisa on Facebook once more. And
Hello, Lubisa.
and they said, when the disc is black on the MRI and thinned out in Croatia, doctors immediately recommend fusion or an artificial disc. What is your opinion on that?
All right, my opinion is it's totally unnecessary. You don't need a fusion or an artificial disc. The doctors in Croatia recommend that because they don't know how to do this surgery. If they knew how to do this surgery, they would be recommending this surgery every time. Not fusion, not artificial disc. This is more advanced. And unfortunately, Croatia doesn't have this kind of surgery. But then again, most countries don't have it either, so don't feel bad. You're watching the most advanced spine surgery in the world. Unfortunately, not everyone knows how to do it. I was doing the fusions and the artificial discs long before other surgeons knew how to do it. Shot? I was doing fusions and artificial discs 20 years ago. 23 years ago. 24 years ago. We were doing the fusions and artificial discs. We were doing them as part of the FDA studies in the United States to see if they were safe and effective, okay? And they're done at universities with top surgeons. That's why it was done at our university. Our site was one of the study sites for the FDA for the artificial disc. So what I can tell you is that's old technology. And when I was trained to do fusions and artificial discs 20 years ago, all the other surgeons were still doing laminectomy and discectomy. And we brought in fusion and artificial disc at our university, and we were doing them, and the patients were doing fantastic. Okay? However, endoscopic surgery is the next stage in the evolution of spine surgery. So all these surgeons now that are doing fusions and artificial discs will start doing endoscopic surgery someday when they actually learn how to do it, when somebody teaches them. But that's the next generation. So you're seeing that now, here, next generation surgery. But it's being done today. The future of spine surgery being done today at Duke Spine Institute.
Just like today.
Being done today.
Future of spine surgery.
Here today. Great question. Shot?
Still waiting one morning, I'm gonna pull in and see that on the billboard.
Make it happen.
I don't know who to talk to.
Jose. Jose and Karen. I tell you, man, if I don't bird dog people, it's so hard to get them to do things. It's like these cultures I've been asking for. If I don't have to sit there and ask, it just doesn't get done. Everyone's used to mediocrity, and they think it's okay to be mediocre. I'm not okay with mediocrity.
Come on, please.
Where I trained, mediocrity would be destroyed, fired, eliminated.
Ready?
You understand what I'm saying? If you were mediocre as a neurosurgeon, you wouldn't survive a month in training. They would kick you out. So we had to become perfectionists to keep our masters happy. And that's why neurosurgeons are so compulsive about their work. You know? Not every neurosurgeon, but the good ones. If I gave an excuse to my attending about something, what's the sodium? I haven't checked this afternoon. You're dead. They'll cut your head off. They'll hang you. Okay? You don't give answers like that. You have to know. So we became conditioned to prepare, plan, always know in advance, always recite, study, plan ahead, and be prepared. Because the expectation was that you should know these things immediately as soon as they're available, right? So it's just a different expectation, a different culture. As a neurosurgeon, we don't accept failure. We don't, we're not sloppy and slow, and we need things right away. We need it yesterday, results yesterday, because people's lives depend on it.
We have a question.
Yeah,
This comes from Marijula on YouTube,
yeah.
and they ask, so when you are cleaning the herniation, the laser touches the bone. Does that not damage the bone?
The laser doesn't touch the bone. Why would they say the laser touches the bone? And does that not damage the bone? Are you kidding me? You know how much damage an artificial disc does to you? Or a fusion? Or a laminectomy? Or a microdiscectomy? Even if we damage the bone with the laser, it would be 1,000 times more damage to your body with a laminectomy or a discectomy, and 100,000 times more damage with a fusion or an artificial disc. That's like drowning in a bathtub versus drowning in an ocean. That's the difference. So no, the laser doesn't touch the bone. The laser is removing the herniation. This right here is the herniation, the blue thing. I love it when people think they're smarter than I am at what I do. That's the tear right there, the blue streak. It's funny. There's so many people that argue with me online, and they think they can take me on an argument, and I just laugh at them. But I always wonder, why do they think they can? Where do they get the idea? And I realize they have no clue who I am. Like, most people have common sense to know that a brain surgeon is very smart, so you don't try to challenge a brain surgeon. But some people don't know that, and of the brain surgeons, of course, did you ever stop to think that maybe some brain surgeons are a lot smarter than other brain surgeons? So not only are you taking on a brain surgeon, but you're taking on one of the smartest of all brain surgeons. And did you ever stop to think about that? That maybe you're not a brain surgeon for a reason. Right? Everybody thinks they're smarter than a brain surgeon, but they don't know what a brain surgeon knows. They just know what, other people on the internet know. Know thy place. I don't pretend to know more about plumbing than a plumber. I don't pretend to know more about roofing than a roofer. I don't pretend to know more about things I don't know more about that I know I don't know more about. I defer to the professionals. I don't challenge them. I do ask questions. Especially in this day and age, you have to ask questions, because people will lie to you and they'll cheat you. And I've seen lawyers cheat. I've seen roofers cheat. I've seen contractors cheat. I've seen just about every person capable of lying and cheating another human being. I take no pleasure in it. That's why we broadcast our surgeries live, so you guys can see everything we're doing. And if I make a mistake, guess what? You're going to see it. Same time that I'm going to see it. And you're probably going to hear me say something like, uh-oh. All right? So I have nothing to hide. And I hide from nothing and no one. There's the tear right there. That's where all of his pain comes from. Okay? How much time? Well, you know, this is a pretty bad herniation, to be honest. It's taken longer than I thought it would. That said, look at that. Another piece just coming out. So many pieces of herniation. They just keep coming. Now, we're inside the tear right now, inside what's called the annular tear. And these herniations just keep coming up and out. They're all loose pieces of nuclear material. And we don't want that, because if we don't get enough of them out, what's going to happen after surgery? You can have another herniation. So I want to make sure I get them all. Oh, there's another one. This is the L4-5, right, Luis?
This one, yes.
Yeah, this is the one that was a 10 out of 10, remember? This is the one that was really uncomfortable for him. Yeah, I'd say 5 more minutes, maybe 8 minutes. Henry, any more questions?
No current questions.
All right. You know, when you're a kid and you're playing at school in the playground, and, you know, everyone knows who the really good football players are, you know? Like, as a kid, because we're all in school together, we all can see who's like the best football player, soccer player, basketball player. And you, as a kid, you learn the best football player or basketball player. You would never challenge that person to a game of basketball unless you just wanted whatever, some exercise. You want to get better. But you don't challenge them with the expectation of winning. You challenge them with the expectation of getting better, learning, becoming a better player. Okay? And maybe someday, after a lot of practice, you may become better than that really good basketball player or football player at your school. But you can't just be better than by challenging them. You have to actually learn. And if you want to know more than a neurosurgeon, you're going to have to study more than a neurosurgeon and learn from all the books and journals. And you're going to have to go to the hospital, and you're going to have to be trained for, you know, at least medical school plus residency. So you're talking a minimum of 11 years right there of 100 hours a week minimum in the hospital learning, 100 hours a week for 11 years. Then you might actually know something. Sorry, this is a reality check for some people. And I'm not here to, you know, make people feel good about their knowledge. I'm here to teach people. I'm also not here to, you know, be challenged by somebody who's has experience at all, who thinks they know more than a doctor, especially one like myself, who's very highly trained. All right. So far, things are going very well. This patient and I had a good conversation before surgery. He has a family and friends that are doctors. Many of them didn't believe in this technology. They saw it online, and unfortunately, many doctors don't understand this technology. And they're just going to say don't do it, but of course they don't have any other offering, any other solution. It's just don't do that, don't do that. Too many doctors are caught up in what we call the standard way of doing things, the most common way of doing things. It doesn't work. It doesn't work when it comes to curing back pain. So you're going to have to think outside the box, because nobody's been able to cure back pain until now. Duke Spine Institute can cure back pain. And we do it every week. We eliminate people's back pain. But we do it through technology that we developed here that is not available everywhere. Most doctors don't know about it. Okay? And so if they don't know about it, they're not going to recommend it. Just about done. Probably 30 seconds. Everything's going very well. By the way, that's a bone spur off to the side there. And if you notice, I didn't do much with it because I don't think much needs to be done. It's really not causing any problems for him. That right there is a bone spur. I don't believe in treating things that aren't causing problems for people. You know? Okay, very good. Looks good. I'm happy with this result.
You did very well.
Yeah, we're not done. I have one more disc to do. What? Oh, this is the last one? Jeez. All right, I guess we're done. I apologize. This is it right here. See the last pieces of herniation coming out? Just squeezing out there. You guys see that? Kind of how they came out, floated away. That's it. That's it. Looks good. Okay. Well, let's see if we can see the nerve. Nope. It's buried in there. Maybe I'll get this little bit right here. A little bit of herniation there. And that's it. Thank you. Good job. We're going to
Lights on, please. Thank you.
clean out the, with a little antiseptic. And we're done. I'm going to show you all in just a moment how small the surgical incision is. It's tiny, 7 millimeters. Listen, I've been to Europe many times, and I know how nationalistic some of the countries are. As a matter of fact, any American that studies history and studies this nationalism, if you ever want to know what it really means, just go to Italy or go to any of those Baltic states, Baltic countries, and you'll see what nationalism is. It's a tremendous sense of pride in their country, their way of doing things. And nothing wrong with that, but sometimes it can be a little bit much, and you won't see it in America, I guarantee you. Now, we are very nationalistic people, but we're just proud of being Americans, but we're not nationalists in the sense historically of what nationalism means. Nationalistic culture or attitudes are people who only support products or ideas that are unique to their country. So when I was in Italy, for example, a very nationalistic country, the Italians, they really, every restaurant is Italian. Good luck finding anything but Italian food. And the cars are Italian. Everything is Italian, Italian, Italian. And you don't see that in the United States. Like we embrace all cultures here, and we support all cultures. But let's say you had a Mexican restaurant in Italy, like nobody's going to go. Like we literally would go to the Mexican restaurant, it would be empty. And then the Italian joint that's selling pizza on the corner is full, you know? And it's consistent. You know, we went there 100 times to Italy. And it's always the same thing. The Italians support Italian things. I'm sure that other countries are very similar, where they have this sense of national pride and they only want to support you know, what they produce, what they make. And I don't blame them. I'm not criticizing that at all. I'm just saying that's how a lot of those countries are. But as an American, I never understood what nationalism meant from a history book until I went over there and I actually saw it, and then it makes sense. All right, great job, everyone. That surgery went well, no problems. I'm going to call the EBL 2 mil.
Copy that.
And we got one more to go.